Nitroglycerin. This medicine relieves chest pain and causes blood vessels to widen so blood can pass through more easily. Thrombolytic, clot-busting, medications. Providers use these only within the first 12 hours after a heart attack. Anti-arrhythmia medications. Heart attacks can often cause malfunctions in your heart's normal beating rhythm called arrhythmias, which can be life-threatening. Anti-arrhythmia medications can stop or prevent these malfunctions. Pain medications. The most common pain medication given during heart attack care is morphine. This can help alleviate chest pain. Percutaneous coronary intervention. Providers restore circulation to your affected heart muscle with a procedure called percutaneous coronary intervention, PCI. This uses a catheter-based device inserted into a major blood vessel, usually one near your upper thigh or your wrist. PCI is a critical tool in restoring blood flow, and the sooner that happens, the better the chance of a good outcome. Hospitals use a metric called door-to-balloon time to measure their ability to treat a heart attack. This is the average time it takes for people to undergo PCI after they first come into the emergency room. PCI often includes the placement of a stent at the site of the blockage to help hold the artery open so another blockage doesn't happen in the same spot. Coronary artery bypass grafting. People who have severe blockages of their coronary arteries may undergo coronary artery bypass grafting. This surgery is often called open heart surgery, bypass surgery or CABG. The acronym is pronounced the same as CABG. CABG involves using a blood vessel from elsewhere in your body, usually your chest, arm or leg, to construct a detour for blood. This reroutes blood around one or more blocked artery sections and brings blood to your heart muscle. Prevention. Can I prevent having a heart attack? In general, there are many things that you can do that may prevent a heart attack. However, some factors beyond your control, especially your family history, can still lead to a heart attack despite your best efforts. Still, reducing your risk can postpone when you have a heart attack and reduce the severity if you have one. How can I reduce my risk of having a heart attack? Although there are several risk factors that you can't control, there are many ways you can help yourself and reduce your risk of a heart attack. These include: schedule a checkup. Find a primary care provider and see them at least once a year for a checkup or wellness visit. An annual checkup can catch many of the early warning signs of heart disease, including signs that you can't feel. These include your blood pressure, blood sugar levels, cholesterol levels and more. Quit tobacco products. This includes smokeless tobacco and all vaping products. Exercise regularly. Aim for 30 minutes of moderately intense physical activity 5 days a week. Eat a healthy diet. Examples include the Mediterranean or DASH diets. A plant-based diet approach is an excellent alternative. Maintain a weight that's healthy for you. Your primary care provider can advise you on a healthy goal weight and provide you resources and guidance to help you reach that goal. Manage your existing health conditions. This includes high cholesterol levels, high blood pressure and diabetes. Reduce your stress. Consider techniques such as yoga, deep breathing and meditation. Take your medications as prescribed. Don't just take medications when you remember to or when you have a doctor's appointment coming up. Keep all your medical appointments. Seeing your healthcare providers regularly can help uncover heart-related issues or other medical problems you didn't know you had. This can also help treat problems sooner rather than later. Being an active contributor to your health doesn't mean you have to make lifestyle changes all on your own. Ask your primary care provider and other providers on your healthcare team for help. They can provide the information and resources you need. If you've already had a heart attack, your healthcare provider will recommend a cardiac rehabilitation program. This program's goals are to reduce your chance of a second heart attack. These medically supervised programs provide counseling and focus on the same healthy living goals listed above. Outlook, prognosis. What can I expect if I have this condition? After you've had a heart attack, you're at a higher risk of a similar occurrence. Your healthcare provider will likely recommend follow-up monitoring, testing and care to avoid future heart attacks. Some of these include heart scans. Similar to the methods used to diagnose a heart attack, these can assess the effects of your heart attack and determine if you have permanent heart damage. They can also look for signs of heart and circulatory problems that increase the chance of future heart attacks. Stress test. These heart tests and scans that take place while you're exercising can show potential problems that stand out only when your heart is working harder. Cardiac rehabilitation. These programs help you improve your overall health and lifestyle, which can prevent another heart attack. Additionally, you'll continue to take medicines, some of the ones you received for immediate treatment of your heart attack, long term. These include beta blockers. ACE inhibitors, aspirin and other blood-thinning agents. How soon after treatment will I feel better? In general, your heart attack symptoms should decrease as you receive treatment. You'll likely have some lingering weakness and fatigue during your hospital stay and for several days after. Your healthcare provider will give you guidance on rest, medications to take, etc. Recovery from the treatments also varies, depending on the method of treatment. The average hospital stay for a heart attack is between 4 and 5 days. In general, expect to stay in the hospital for the following length of time. Medication only. People treated with medication only have an average hospital stay of approximately 6 days. PCI. Recovering from PCI is easier than surgery because it's a less invasive method for treating a heart attack. The average length of stay for PCI is about 4 days. CABG. Recovery from heart bypass surgery takes longer because it's a major surgery. The average length of stay for CABG is about 7 days. When can I resume my usual activities? Recovery from a heart attack after leaving the hospital depends on the severity of the heart attack, how soon treatment began, the methods used and the health conditions you had, if any, before your heart attack. Your healthcare provider can explain the next steps for your recovery and what you can expect. In general, most people can return to work or resume their usual activities anywhere between 2 weeks to 3 months after their heart attack. Cardiac rehab can help people gradually and safely increase their physical activity back to its prior level. Living with. What are the complications of a heart attack? Complications associated with heart attacks include arrhythmias, abnormal heart rhythms, heart failure, heart valve problems, sudden cardiac arrest, depression and anxiety. Mechanical complications of a heart attack, such as a ventricular septal defect or free wall rupture. These are more likely to happen with delayed treatment of a heart attack. Who fares better after a heart attack? Younger women, pre-menopause, and people AFAB under age 45 have a better outcome than men and people AMAB of a similar age. Scientists believe this is because of estrogen's heart protective effects. However, after menopause ends the protective benefits of estrogen, women fare worse than men. More specifically, women between the ages of 45 and 65 who've had a heart attack are more likely to die within a year of the event compared with men of this same age. Women over age 65 are more likely to die within weeks of their heart attack than men over age 65. Frequently asked questions. Why should I call 911 if I can drive myself to the hospital, or have someone drive me? If you have any symptoms of a heart attack, it's best to call 911 for multiple reasons. First responders can do some of the early testing and treatment for a heart attack on the way to the hospital. This can speed up the overall diagnosis and treatment process. If you come into the hospital by ambulance, you usually have more immediate access to care. When you're having a heart attack, every second matters. Heart attacks can cause your heart to beat irregularly or stop entirely, either of which could cause you to pass out. If you're in an ambulance when that happens, first responders can react immediately to stabilize you. You also won't have to worry about passing out behind the wheel and causing a crash that could have devastating consequences for yourself or others. How common are heart attacks? New heart attacks happen to about 635,000 people in the U.S. each year. About 300,000 people a year have a second heart attack. About 1 in 7 deaths in the U.S. is due to coronary heart disease, which includes heart attacks.